and my empty soap note. Okay. Hello, Mr. Okay, Chuku, Ibeneme. Is it okay for me to call you okay?
Sure.
My name is Nkasiobi. I'm a family nurse practitioner student. Before we begin, is it okay for me to record this?
Sure, you can.
Okay. And can you confirm your date of birth, please?
July 22nd, 1974.
Thank you. And can you tell me what day it is today?
Today is Monday, 16th of July.
Okay. I'm gonna say as so may I know what brought you in to see me today?
Well, I have a cough.
A cough?
Yes.
Okay. When did your cough start?
6 days now.
6 days. So can you describe your symptoms, other symptoms? How is it your cough?
It starts with a cough, and then I have a pain on the neck, and then a headache.
Okay, so the cough started. Did the sore throat and the headache start with the cough?
No, the cough started first, and then the sore throat, and then the headache.
So the cough brought about the pain in your throat and your head.
Yes.
Okay, so it's located just there. Does it move anywhere else?
No, just here.
Just there. Okay. Okay. What makes your cough better?
Water. I drink water, and it soothes it a little bit.
Okay. Just water. What makes it worse?
When I lie down.
Is any particular time or just when you lay down?
Anytime I lay down.
Okay. So have you taken any medication for it?
No, I haven't.
Have you taken any cough medication?
No, I haven't.
So are you in pain now?
Not really. Only when I cough.
So can you on a scale of 0 to 10, with 10 being the worst pain and 0 being no pain, what level is your pain? When you have just
4.
Or 4, and you did not take any pain medication.
No.
Did you see? Have you gone to see your doctor?
No, I haven't.
Okay, until you came in here.
Yes.
Okay, so do you have any history of asthma?
No.
Or any breathing, any chest?
No.
None at all. Do you have a fever?
I have a little. I was running a little temperature about 2 days now. That's what I noticed.
Okay, so you noticed your
my body was a little warm.
2 days.
Yes,
now.
for 2 days now.
Okay, and did you take anything for it?
No, I haven't.
Nothing for it. Okay, so do you? I'm gonna ask you some other little questions. So are you allergic to any medication?
No, I'm not.
Are you allergic to any food?
No.
Any other allergies that you know of?
No.
Do you take any medication? I know you said you didn't take anything for cough. Are you on any medicine?
No, I'm not.
Not even vitamins, nothing?
No.
Okay. Do you when was your last physical?
About 2 years now.
2 years. What did you get done?
It was a regular physical.
Just a regular.
Just my regular annual physical.
Okay. Any immunization that you've done, like flu shots?
No, I didn't do none this season. No.
None at all.
Yes.
Do you smoke?
No, I don't.
Do you are you exposed to people? Are you around people who smoke?
Yes, in public places, and I have friends that smoke.
Okay, so but you don't smoke.
But
Do you use any drugs? Any illicit drugs?
No, I don't.
Any alcohol?
No,
use? None of that.
No.
Okay. So any surgeries, hospitalization? Have you ever been?
No.
No surgery, no illness,
no
sickness in the past, no such. Okay. Are you married?
No.
Are you in a relationship or?
Yes, I am.
Okay, so are you? What's your sexual? Do you mind if I ask what's your sexual orientation is?
That's okay. I'm healthy. I have a healthy sexual life.
Okay. Are you monogamous?
Yes, I am.
Okay. Do you use any form of birth control?
No.
None.
None.
Okay. So what about any fever? Okay, you said you have a fever. Do you have any chills?
Just a little bit. No chills.
Any joint pain?
No.
Any other body symptoms? Chest palpitations? Difficulty breathing?
No.
None. Any nasal congestion?
No.
None. Okay. What about are you eating well?
Yes, I am.
No, it has not affected your appetite?
No, my appetite is still good.
Okay. And are you using the bathroom well?
Yes, I am.
You are?
Yes.
You're going to the bathroom, pulling when everything is
yes.
fine? Okay. So let's talk about your family. So you said you're single. You live alone.
Yes.
Okay. Do you have any other sports and any other things you do apart from? So what do you do?
I'm self-employed. I
Okay.
own my own business.
Already. And any curricular activities, any sports, any?
No, no, not at the moment. No, I don't.
Okay. Now, so let's talk about your your family. If you don't know, if you don't mind, are your parents alive?
My mom is not here, but my dad is alive.
Okay. And what age was your mom when she died?
He was about 44.
Okay. Did she have any health, any was she diabetic?
Just a migraine.
Just migraine. Okay.
Yes.
And your dad?
My dad is fine. Just that he just had a stroke, but he's doing better.
Okay. So just stroke. Any
Yes.
other health history?
No, no, no.
When did he have the stroke?
About a year ago.
And he's doing better. You
He's
said.
doing much better.
Okay. What about your father's mom?
My father's mom, she's late,
Okay.
but she died about 100. She had longevity.
Any health issues that you know of?
Nothing.
Your father's father?
He died before I was born, so I don't know.
You don't
much
know.
about
Okay. What about your mother's father?
it. Yeah, and he was quite old.
And any health issues?
No.
And your father's
Was
mother?
old. She was old too when she died.
I know.
No.
Okay. Do you export your siblings? How many do you have siblings?
Yes, I do.
How many?
4 siblings.
Okay. And any health issues?
No.
None at all. Okay. Do you so let's become so you have a cough that started 6 days
6 days ago. Yes.
and then you said as the cough progressed you noticed that you have sore throat and headache.
Yes.
And then 2 days ago you noticed your temperature, you have a fever.
A little bit,
a little
yes.
bit of mild fever. Okay, so that's why you came and you haven't taken any medication.
No, I haven't.
Nothing, no pain meds, no cough meds, nothing.
No, I haven't.
No, and then you don't have any no diabetes, no history of diabetes or
Not that I
hypertension.
know of.
Okay, not that you know. Okay, and thank you. I'm gonna complete a head to toe assessment on you today. Just to check what a head to toe assessment means is just to check your body system from your head to toe, just make sure everything is fine. Rule out, And do you consent to that, please?
Sure, if that's what you have to do.
Okay. So I'm gonna if you can just take your shirt off for me, and I'm gonna wash my hands, and then I'll come back and we'll start. Okay?
Okay.
So before we start, I'm just gonna show 360 around the room. This is a video of the room. This is the show you around the room, and then this is the stuff. Here I have my Rosabon chart, and I have my ophthalmoscope. I have my otoscope. I have my tuning fork. I have my marker, my tape, my reflex hammer. I have gloves and water, and I have my speculum and some alcohol wipes. Okay, they are laid out. Okay. So, just washing my hands real quick. Thank you. So, wash my hands. So, before I start, as you can see, okay, he appears his stated age. He's alert, oriented to person, place, and time. He was appropriately dressed before he took off his clothes. He communicates effectively. He's cooperative, and we're gonna start. So I'm gonna start by inspecting his skin. I'm checking his skin. His skin is warm to the touch. It's dry. I don't see any open lesions. I don't see any. Can you recollect? I don't see any markings, no tattoo, no piercing, no mask. Everything looks good. His silver is elastic here, and I'm gonna pick down my way down. Check his fingers. I'm looking at his fingers. I don't see any open lesions, no wound. His nails is pink and firmly adhered. He's angled at a 160 degree. I'm checking for capillary refill bilaterally, and it's less than 2 seconds. I'm going down. Can you lay down? We can look at your legs. Now I'm looking at his legs, checking for pedal edema. I don't see any, no swelling. Checking for his capillary refills as well bilaterally, and it's less than 2 seconds. Thank you. Can you sit up? Next, I'm gonna check his hair. He's shaved. I can see little hair evenly distributed. It's clean, no infestation. Do you feel pain when I touch?
No.
His scalp is non-tender. I don't see any inflammation. I don't see any open lesions. Nothing. It's good. Next, I'm going to check his head and his neck. As you can see, his head is normal cephalic. It's upright. It's still. I don't see any. His facial features is symmetrical bilaterally. I see fine venous hair all over his face. I don't see any open lesion, no wound, nothing. And I'm just going to look at his, walking down to his neck. I don't see any neck fullness. His trachea is midline. And his thyroid is smooth. I cannot feel pathways, which is good. It's smooth. I'm going to check his carotid pulse one at a time. And it's regular. Wait and rhythm. I'm going to check the other. Regular. Next, I'm going to auscultate his thyroid artery with the bell of the stethoscope. We use the bell to auscultate for brewery, while we use the diaphragm for high pitch sound. The bell is used for low pitch sound. So I'm going to use that to auscultate his thyroid for brewery. Check to see. Non-noted. I'm also gonna auscultate his thyroid gland for brewery with a bell. Not noted. Now I'm gonna check his thyroid. Yeah. Can you drink this? Just take a sip, but don't drink until I tell you to. Thank you. Just lift your head and then swallow. Do you feel any pain when you swallow?
No.
So I saw his thyroid and his cartilage move while he swallowed, so that is good. Next, I'm going to assess his eyes. First of all, I just want to take this off if you don't mind, so I can check the eye. His eyelids and his eyelashes, I can see evenly distributed. His eyebrow, the eyeball is firm. Eyebrow is symmetric. I'm looking at. Do you feel pain when I touch this?
No.
His lacrimal apparatus is soft. No erythema, no exudate. Around it, I don't see any drainage. I'm going to open your eye to look at the. So I see his conjunctiva. Both of them bilaterally, they are clear. His sclera is white. I'm going to start with the. So before we started, I already checked. I made him empty his bladder, and I took his height, and I took his weight and his height. I checked that. I checked his vital signs, and I also checked his visual acuity using a Snelling check, which we used to check for long distance vision, and it was a 2020 with him wearing his glasses. Now I'm going to check his short distance vision with this Rosenbaum chart. So if you can take off your glasses first and read the, hold it and read the.
2843.
Let me see that. And can you close your eyes? The other eye can read the.
874.
And can you wear your glasses and we'll do the same percentage? Okay.
8745.
Okay. And can you do the other one?
63925.
Okay. So without the glasses, he is 2070, and when his glasses, he's a 2050 on the Rosenbaum chart. And here I'm gonna check your So I'm gonna, can you please take your glasses? I'm gonna start with the I'm gonna check the reflex your pella, your pupil reaction to light. So I'm gonna check for his pella. Thank you. And then his people do react to light. I'm going to check for his people reaction to accommodation. Just and just look at something. Look at the piece object behind. I'm just going to put this in. Yeah, and his people did react to accommodation. Next, I'm going to check for his corneal light reflex. Just look at something behind. Yeah, and it did reflect symmetrically. If it hadn't, we would have done the cover on cover test, which I'm going to demonstrate now. Can you uncover, 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 and uncover, uncover, uncover the other, uncover. And so he performed that without any ocular deviation. Next, I'm going to check for direct and consensual gaze. Okay, I'm just gonna shine the light first directly. I just want to see concentration, and it did concentrate. Now, can you put your hand in between? Now I'm gonna check that consensual. When I shine the light here, I want the other eye to concentrate, and then when I shine, I want this other one to concentrate. So I'm gonna shine that in here and see. Yes, and it did. Yeah, and it did concentrate. Okay. Next, I'm going to do, before I do my eye exam, let me do check for cranial nerve 3, 4, and 6, which is testing for this is extraocular vision. Okay, so you're going to keep your head straight and just follow the movement of my the pen. So you can see his cranial nerve 3, 4, and 6 intact. Then I'm going to check for peripheral field, which is also testing for cranial nerve 2. Can you close your eyes? And then let me know when you see my fingers, okay?
Yes. Yes. Yes.
Close the other eye, please. Thank you. Let me know when you see my fingers.
Yes. Yes. Yes.
Thank you. So cranial nerve 2 is intact. Now I'm gonna do the ophthalmoscope exam. I'm holding it. I'm gonna test his right eye with my right eye. Raising his head so I don't hit him. So right eye. I see the red reflex and I'm gonna move in. Thank you. And I just look at something straight ahead. No, I just fix your eye on something any thing behind while I check the other eye. His my left eye with his left eye. See the red reflex, I'm gonna move in. Raising his head so I don't hit him. Thank you. So my ophthalmoscope exam showed red light, red reflex bilaterally. I could see his optic disc, well-defined margins. I did not see any perforations. His retinas are red. I didn't see any nickings, any exudates or arrhythmia. Everything looks fine. Before I do, I'm going to check his lymph nodes now. I'm going to start by checking his occipital lymph nodes. And then I'll go back to his preauricular and his post-auricular down to his tonsillar lymph node, and then to his posterior cervical, anterior cervical, his submandibular, his submental, and his supraclavicular lymph nodes. Any pain while I touch? No. Can you lift your pain? Now I'm going to feel for his axillary lymph nodes. Any pain?
No.
And then his epitrochlear. Any pain while I touch? No. Thank you. So I'm going to move on to examining Okay's ears. As you can see, his pinna is in alignment with his inner canthus. The lobes, any pain? No. It's non-tender. There's no lesions. I don't see any inflammation, any arrhythmia. I'm going to start with the otoscope test. So, holding my otoscope like I would a pencil, I'm going to lift his ear up and out and put the scapula in. Scapula. And look at his ear. I'm going to look at the other one. I'm still holding my otoscope like I would a pencil. Lifting his pinna up and out. Putting the speculum in. Thank you. So my otoscope exam showed ectalan that is free of arrhythmia. I did see some little serum, just a little, but his tympanic membrane bilaterally were pearly gray, no retractions, no bulgings. His right cone of light was at 5 o'clock and his left cone of light was at 7 o'clock. I did not see any perforation. Next, I'm going to do the Weber and Ryan test. First, I'm going to start with the Weber test, the test for lateralization. When he put this on your head, you let me know if you hear it equally in both ear or in one ear or the other, okay?
hear it in both.
Okay, did it stop?
Yes.
Okay. So the Weber test show vibration and lateralization equally in both ears. Next, I'm going to do the Ryan test. I'm going to hit this and put it on the master process. You let me know when you stop hearing it, okay? Just going to come here.
Yes. It stopped.
I'm going to do it again. Let me know when it stops here and then here, okay?
Okay. It stopped.
Okay. And let me know when it stops.
Yes.
Okay. The Ryan test shows air condition is greater than bone conduction, which is what we want, which is nice. Now I'm going to test for cranial nerve 8 by doing the whisper test. Okay, so can you just put your ear, hold on. And I'm going to whisper something to you. What did I say?
Boy shot.
Thank you. Can you do it down here? What did I say?
So they're good.
Good. As you can see, his cranial nerve 8 is intact. Next, I'm going to check his nose. First, I'm going to inspect his external nose is midline. I don't see any lesions, no perforations, nothing, no drainage out of his nose. I'm going to check for patency. It's patent bilateral. I'm going to double test. Okay, I'm going to check. Just going to put the spatula in. Inspect your nose. Thank you. I'm going to look at the other nose. Very nice. It's pink. So my otoscope exam showed his nasal mucosa is pink and moist. I did not see. Are you okay? I did not see any arrhythmia, any edema, and his spectrum is intact. Thank you. I'm quickly gonna put on the gloves. I can inspect your mouth. Okay. Okay. So I'm gonna start by looking at around his mouth, trying to see. I don't see any lesions, no wound. Opening his mouth. Can you open your mouth, please, for me? I see his buccal mucosa is pink, and his gum is pink. I see he has all his teeth, about 32 of them. Can I see your tongue? His tongue is looks the appropriate size for his mouth. Can you move your tongue? So the movement is symmetrical. Put over. Open your tongue. I see. No, can you? Yeah. Use the tongue to press. Open your mouth. Open your mouth. His palate is a bit red, maybe due to the sore throat, the little red. Can you say ah? His uvula is midline and moves when he says ah. His tonsils is like a +1. Little red. Okay, thank you. I'm gonna check cranial nerve 9 and 10 now. Open your mouth. I'm just gonna stick it. Open your mouth. Open your mouth. Okay, thank you. I'm sorry. I checked your gag reflex. So I just checked for cranial nerve 9 and 10. His cranial nerve 9 and 10 is intact. His gag reflex. I'm gonna take this off. So I'm going to start assess his chest now. I'm looking at his chest wall. First, his AP to transverse diameter is 1 to 2. His chest is elliptical. I don't see any deviations. I'm looking at his breathing. He's breathing even and non-labored. He's not hunched over, so he's not in distress. I don't see any use of accessory muscle or any retractions. It looks good. I'm going to start with percussing for resonance. Yeah, percussing for resonance. And then I'm going to auscultate his anterior chest wall. Before I percuss, can you lift your so I can percuss your lateral as well? Thank you. Thank you. Percuss this up, lateral chest. Thank you. And then can you turn so I can percuss your posterior? Can you turn around, please? Thank you. Can you do? Oh, yeah. I'm trying to from maximum chest. Asking to bend his elbow so okay. Okay. Starting at the scapula line. Testing for resonance. This is what we want to hear. Thank you. And then I'm just gonna start with auscultation. Okay. And can you turn around, please? Deep breath. Can you breathe in and out? Thank you. Can you lift your hand, please? Lift up. Deep breath out. Thank you. And from here. And out. Have 3 lobes in the right. Thank you. Thank you. So I heard bronchial sounds over his trachea and his larynx. And then his left and right second intercostal space was bronchial vesicular, and all over his lung fields was bronchial was vesicular breath sounds, and also percuss. When I percuss, it was resonance. So his breath sounds is 14. His breathing is regular. I did not hear any adventitious sound. Thank you. Next, I'm gonna check his heart. We both want to know assess his heart. The heart position is done in three. Heart assessment is done in three positions. Can you sit up? Move this. It's done in three positions. We're gonna do the sitting. I'm gonna start by inspection. I'm gonna palpate his apical pulse and his pericardium, checking to see any abnormalities, any pulsation, any heaves, thrust. Everything looks good. I'm going to start with auscultation. First, I will auscultate with the diaphragm. I'm going to start at the aortic arch, which is the right second intercostal space on the sternal border. Here we have the S2 rather than the S1. I'm going to his pulmonic, which is second ICS on the right sternal border. Here also S2 is greater than S1. And I'm here to his second pulmonic, or the Epps point. Here the S2 is equal to S1. And down to his tricuspid. The S1 is hardest than better than the S2. And then his mitral area, which is also the PMI, fifth ICS mid-clavicular line, also where we hear the apical pulse. Here the S1 is also louder than S2. Just going to check his apical pulse. Okay, so I'm going to auscultate with my the bell, just to see here for murmur. Like I said, the bell is used for low pitch sounds, while the diaphragm is used for high pitch sounds. So I'm going to use the bell to try to hear from here, going from the aortic, pulmonic, Epps point, or second pulmonic, tricuspid, and the mitral. His pulse is regular, has a regular rate, rhythm depth. It's about 68. I did not hear any gallops, any murmurs, any brewing, nothing, no abnormal sounds heard. Thank you. Next, I'm going to check his blood vessels. We're going to start with I'm going to check bilateral, starting with his radial, his brachial pulse. And then his radial pulse. Checking his radial pulse. Okay, you can lay down on the place. I'm gonna check his popliteal. This leg. Okay. I'll bring this close. Okay. I'm checking his popliteal. checking his popliteal fossa. Can you move? Yeah, thank you. Thank you, sir. Thank you, okay. Thank you. And I'm checking his dorsalis pedis and posterior tibia pulse. Thank you. Next, I'm going to assess his abs. Yep. Next, I'm going to assess his abs. I'm looking at his ab. First, I'm looking at the contour. It's round contour. I'm trying to see if I'll see any pulsations, especially from the aorta. I see nothing. I can see he's moving with his as he breathes, with the movement as he breathes. First, I'm going to start by look, assessing the auscultating. I've done the inspection, but I see a little bed mark here. Otherwise, there's no scarring, nothing. So the abdomen has 4 quadrants. I'm going to auscultate starting from the right upper, left upper, right lower, left lower. Checking for vowel sounds, and he has vowel sounds, active vowel sounds. Next, I'm going to percuss around for tympani, around the quadrants. Yep, that's good. And then I'm going to check for his liver span. I'm going to percuss down like here, door. I'm going to mark it. And then start up, like here, door. I'm going to mark that as well. Thank you. I'm going to measure. It's about 7 centimeters. And I'm going to also percuss for splenic dullness, the right. I shouldn't really feel the pain. Okay, now I'm going to start with light palpation. Any pain?
No.
Just lightly palpating, trying to see if there's any tenderness, nothing, it's not pain. Then I'll start with a deep palpation around the quadrants, the 4 quadrants. I'm going to palpate for the right coastal margin for the liver, and at the left coastal margin for the spine. I don't really feel the spine. I should not. Any pain?
No.
Okay. Next, I'm going to check for osmosis sign to see. I'm going to push in, take a deep breath. Any pain with breathing? No. So I can see he has a negative Murphy sign. I'm trying to check for inflammation of the gallbladder, the right side. So he said he didn't have any difficulty with breathing, so that is good. So while he's laid out, I'm going to start my musculoskeletal thing. And can you lift your knees up? Your knee, both knees. Thank you. Abduct and bring them together. Thank you. Push down, down. And can you just slide up and down with one? Yeah, thanks. And then the other one. Thank you. Can you okay? Yeah, I'm sorry. I can see he is the way he stood up. I see he has no problem with muscular. Can you I'm gonna check your range of motion. Can you go up and then back forward and then like side to side. I'm gonna check use the opportunity to check for cranial nerve 11. So don't try to shrug against my resistance. Thank you. And then can you don't let me push your face. Good. And don't let me push. Yeah. As you can see, cranial nerve 11 is intact. Thank you. Um, can you? I'm gonna do the coordination. Can you do this? Put your finger to your fast and fast like that to your toes. Thanks. Good. As you can see, his coordination is fine. Can you do touch your toes to your like that? With one thumb, just go around your fingers, and the other one. Thank you. You can see his coordination is fine. And now we're gonna start the stand up, please. Can you bend? Just bend him down. I'm checking for his spine. Just go down. Thank you. You can see there's no deviation. It's fine. Thank you. Can you stand and close your eyes? Put your hands around, just to your sides, and just close your eyes. Doing the Romberg test, as you can see, there's no lateral, no move. No, he's okay. So he's checking for his balance. It's fine. Thank you. Can you see that? I'm gonna start the neuro. I have already done the I've already checked for cranial nerve 2. Can you close your eye? Let's start with 1. What is alcohol? Yeah. Cranial nerve 1 is intact. I have already done cranial nerve 2 when I did the Snellen peripheral optic double. We checked the chart and we did the peripheral feeds. And I did cranial nerve 3, 4, and 6 when we did the extraocular movement. I'm going to check for cranial nerve 5. Close your eyes and let me know if you feel it. Can you touch you?
Yes. 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 Yes.
So cranial nerve 5 is intact. I'm going to do cranial nerve 7. Smile for me. Close your eyes. Open. Wiggle your forehead. Puff your cheeks. Stick out your tongue. Okay. Cranial nerve 7 is intact. I already checked for cranial nerve 8 when we did the whisper test. And I checked for cranial nerve 9 and 10 when I did the gag reflex. I did cranial nerve 11 when we just checked for the shrugging of his face and shoulder. And cranial nerve 12. Stick out your tongue. Stick out your tongue and move it from side to side. Thank you. I'm going to put this around. Stick out your tongue. What do you taste?
Alcohol.
Good. Cranial nerve 12 is intact. Thank you. I'm going to go to the reflexes. First, I'm going to check his I'm going to start with the brachial. Thank you. You can see the movement. And I'm going to do the other one. Thank you. And I'm going to start to do his brachioradialis. And then okay, good. And I'm going to start with the radial. Oh, let's do the patella. Done that. Then I'm going to do his patella reflex. No, I just want to have it go down so you can see the. Okay. Already. Just go here. And then the other one. And then this Achilles. Hit here. You know, see the reaction. And then we're going to do the plantar flexion. Okay, though. Thank you. Just gonna check. While we did your this, and I have to check for tri-type parameters for derivation. I'm just gonna put my hand on. You said 99. When you feel my hands on you, please say 99.
99. 99. 99.
Thank you. And then tongue around, please. No tongue to that. Thank you.
99. 99. 99.
Thank you. So no tighter prematus head. I have 51 minutes left. Thank you, Mr. Okay, for letting me. We're gonna do run some other tests and then we'll let you know, okay? But thank you so much for letting me do the head and toe, complete the head to toe assessment, and you have a wonderful day.
You too.